Hello and welcome back to the DJ Eclectic. Okay, so DJ here, and I'm going to talk to you today about a new population-based study. Now, it's conducted by Harvard University affiliated Mass General Brigham, and was found that cardiac deaths. Now, don't switch off. Stay with me. This is important. Have increased significantly since the onset of the COVID-19 pandemic, 2020, with many occurring in homes, heart attack cases, many occurring in homes rather than hospitals. This report is just less than 30 days old because it was published on May the 30th and it's now the 27th, so it's just less than a month old, and it was published first of all by the JAMA Network Open in America, and the study offers one of the most comprehensive analyses to date, examining population level cardiac mortality over the past decade, over the last 10 years. In this population-based cohort study of Massachusetts descendants, they found cardiac deaths increased substantially starting in 2020, when COVID was announced, with exaggerated seasonal patterns and increases in death at home. The researchers wrote, using death certificates data from Massachusetts between 2014 and 2024, mid-2024, the research team compared observed cardiac mortality rates with the expected trend. And from 2020 to 2023, cardiac deaths remained significantly above the baseline levels, rising as much as 17% higher than expected in every multiple year. Now, the study findings highlight potential shortcomings in cardiac care during and in the years following the height of the pandemic, suggesting opportunities to better treat and prevent cardiac events in the population and in the people that were at risk. Now, there's a guy called Jason Wasfy. He's MD and he's Director of Outcomes Research at Massachusetts General Hospital. And he said, today there's been a lot more people dying from cardiac events at home, which also raised the concern that people with heart diseases haven't been getting the care they need during and after the pandemic. Okay. Now another one, he's a senior author of this report, is John Yuzu. He's an MD as well, and he noted, had we not examined mortality rates using death certificate data, the increase in population cardiac mortality would have gone unnoticed, because in America, the hospitals only report deaths that occur in the hospitals, so they miss out all their local doctors and medics. Cardiac mortality has increased in Massachusetts and has persisted for years after the onset of the COVID-19 pandemic, and with the shifts in location, hospital, home, on the playing field, and they've added that further work is needed to improve the resilience of cardiac care. Now, what I want to do is, that was just a short brief, but what I picked up on this report was mounting studies explore heart risks tied to the mRNA COVID biologics, the vaccine. The data generated by the study adds to a growing body of evidence examining potential cardiovascular risks, particularly in young people, associated with the mRNA COVID shots. A 2024 report, so it's not that long ago, highlighted a troubling 66% increase in heart attacks among young adults. 66% increase in heart attacks over young adults over the previous 4 years. And 1 in 5 cases now occurring in individuals under 40 years of age. Experts pointed to multiple contributing factors, including lifestyle changes, infection related complications, and possible links to the mRNA vaccination, which has been associated with serious conditions like myocarditis and pericarditis, especially in younger males. Now, I have done a report on this, which you can see. I did it earlier, a couple of weeks ago, I believe, maybe a couple of months, I'm not sure. But yes, young people are suffering from myocarditis, which is the inflammation of the heart, and pericarditis, which is the inflammation of the sac of water that's around the heart, that protects the heart. Now, the inflammation is obviously, if it's inflamed, it gets hotter, and it eventually the heart attack. Okay. In February 2024, a large-scale peer-reviewed study published in Vaccine by researchers from the Global Vaccine Data Network, an international collaboration that includes World Health Organization, analysed over 99 million individuals. So this is no small report. Over 8 countries. The study identified statistically significant associations between COVID vaccines, including vaccines manufactured by Pfizer, Moderna, and AstraZeneca, and 13 adverse outcomes from the vaccination. Adverse. Such as myocarditis and pericarditis, blood clots in the brain, Guillain-Barré syndrome, that's where the face goes all down, and other neurological and hematological blood disorders. While the authors noted that the outcomes remain rare, the scale and precision of the study has prompted reviewed calls for ongoing vaccine safety surveillance and transparency of the risk-benefit analysis, the balance between the risk of COVID and the benefits of the vaccine, especially among lower risk populations such as young men and adolescents. Now, I want to tell you, the study follows a recent FDA, that's the American Food and Disease Agency, update required updating warning labels on COVID shots. They have demanded warning labels on the COVID shots. Just weeks after the release of the cardiac mortality study, the US Food and Drug Administration, the US Food and Drug Administration, FDA, directed vaccine manufacturers Pfizer and Moderna to revise their COVID-19 shot warning labels to include the risk of heart inflammation, pericarditis, myocarditis. The update is applicable to the current 2023-2024 mRNA vaccine formulas, and it specifically cites the increased risk of myocarditis and pericarditis, particularly in adolescent boys and young adult men. It seems to affect young males, a lot more than women. Following the administration of the 2023-24 formula of mRNA shots, the highest estimated incidence of myocarditis and pericarditis was in males aged 16 through to 25 years of age. The FDA states it is revising labelling, now requiring both mRNA and COVID biological products, and this move follows mounting post-market surveillance data and litany of studies documenting the elevated risk of myocarditis in young males, particularly after the second mRNA dose. Be warned. I've just brought this out for you because it's very worrying. I've had a massive heart attack, but mine wasn't from vaccinations, mine wasn't from a disease, mine was from a bacteria that was put into my, a virus that was put in, 5 actually, but 3 attacked my heart. And when I had a replacement, my first replacement hip joint, the whole bone and the connector, they went in with the disease and that attacked my heart. But so I'm very concerned on this. I am a former paramedic. I am qualified, and so I've seen these things. So be warned. Be warned. Take it easy. Don't just accept a vaccine because everybody's having one. They've got lots of things in them that should not be in our bodies. So let's not keep it going. Just be safe. And that's it all from me for this morning. So until the next one, be safe, be good, and goodbye from DJ. Bye.